Your primary care doc gave you a higher dose, you said, of ibuprofen?
He gave me diclofenac. And said, oh, take that, and it didn't do anything for me, and none of the things they were doing did anything for me.
We're discussing the medical model, the medical approach to back pain, sciatica, disc herniations, and their approach is ibuprofen, medication, whatever it may be. There's a whole list of them. I'm not going to go into the list of medications they'll throw at you to help you with pain. Just like an article today that came out, or yesterday, that antidepressants show they do not help with chronic pain sufferers. And my thought is, well, yeah, they're antidepressants.
Yeah.
You know, like, is that a surprise to anybody that they don't work? I mean, anyway, going back on track here, that's the medical approach, is to give you medications. If those don't work, injections. If that doesn't, and then physical therapy. Again, they rarely refer you to a chiropractor. They just don't learn in medical school what we do. They don't even spend a minute on it. And it's a shame, because medical doctors are supposed to know when to refer out, just like chiropractors. So just the other day, I had a case, and I actually referred the case to an oncologist, okay? And as a doctor, you have to know who to refer to, and medical doctors utterly fail at that. And also, they tested medical doctors, internists, and family physicians on their knowledge of musculoskeletal knowledge, and it was dismal. It was bad. It was really bad.
You guys are like in parallel paths, but there's no connection. There's no.
No, the medical, it's the medical schools. They're somehow threatened. There's a connection between the medical schools, the AMA, and Big Pharma, and the pharma trains the doctors in the medications to use for certain things, and then they do that through the AMA. It's just big business. What can I tell you? And unfortunately, a lot of doctors don't refer to chiropractors. Some do. And I'll tell you what, if you have a disc herniation and your neurologist or your doc refers you to a chiropractor, he's forward thinking. He just cares about you getting better. And somebody educated him on chiropractic. So I actually take doctors out to lunch, and I try to educate them on what I do. So we do get some referrals from surgeons, and even though I've done that, some doctors are just not open to what I do. They just don't know. They think we're chiropractors are putting people on their back and racking them and cracking them, and if you watch on YouTube, you would get that impression as well. There's some awful stuff being done on YouTube, and people with Y straps yanking on people's necks, and this is why they get this impression of our profession.
Is that why you
it's
started
unfortunate. That's why I started this channel. That's exactly why I started this channel, to explain what we do and explain the difference and the uniqueness of chiropractic. And I'm going to help her get out of surgery and avoid surgery. How long? I don't know. For as long as I'm in practice, and hopefully she finds somebody after I retire to help her. But Cox flexion distraction technique with cold laser therapy. If you've got all these conditions she's dealing with and you haven't done that, try it. And give it a fair trial of 4 to 6 weeks. You should see at least 50% improvement in 4 to 6 weeks. Okay, now I'm gonna take that laser off of you here, okay? And now we're gonna do the Cox flexion distraction technique, so hang tight. We're not done yet. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't forget to subscribe. Appreciate you guys.